How serious COVID-19 is? And how can I protect myself? Well, we all know that a new virus has been identified in China in November 2019, which was spread all over Chinese provinces and caused more deaths within a short period of time. This virus has been identified as new coronavirus or COVID-19, as this was the seventh virus has been identified in the coronavirus family. This virus started to spread from China to all over the world in the mid of March. Almost all countries in the world have been affected by the COVID-19 decease and death toll raised rapidly till April and decreasing slowly due to the prevention followed by each country's government. In March 2020, the World Health Organization (WHO) declared COVID-19 a pandemic. Public health groups, including the U.S. Centers for Disease Control and Prevention (CDC) and WHO, are monitoring the pandemic and posting updates on their websites. These groups have also issued recommendations for preventing and treating the illness. How does COVID-19 spread? Data has shown that it spreads from person to person among those in close contact, within about 6 feet or 2 meters. The virus spreads by respiratory droplets released when someone infected with the virus coughs, sneezes or talks. Do you know the symptoms of COVID-19? COVID-19 symptoms can be very mild to severe. Some people have no symptoms. The most common symptoms are fever, cough and tiredness. Other symptoms may include shortness of breath, muscle aches, chills, sore throat, headache, chest pain, and loss of taste or smell. This list is not all-inclusive. Other symptoms may appear 2 to 14 days after exposure. Can COVID-19 be prevented or treated? A vaccine isn't currently available for the coronavirus disease, COVID-19, till May 2020, but physicians treat COVID-19 at relieving symptoms of the patients. The person with a strong immune system can be cured quickly. How can I avoid catching up COVID-19? The CDC recommends following these precautions for avoiding COVID-19. Avoid large events and mass gatherings. Wear a cloth face mask in public areas. Avoid close contact, within about 6 feet or 2 meters, with anyone who is sick or has symptoms. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Throw away the used tissue. Avoid touching your eyes, nose and mouth. Clean and disinfect surfaces you often touch on a daily basis. If you have a chronic medical condition and may have a higher risk of serious illness, check with your doctor about other ways to protect yourself. Should I wear a mask? Doctors recommend wearing cloth face coverings in public places, such as the grocery store, where it's difficult to avoid close contact with others. It's especially suggested in areas with ongoing community spread. This updated advice is based on data showing that people with COVID-19 can transmit the virus before they realize they have it. Using masks in public may help reduce the spread from people who don't have symptoms. Non-medical cloth masks are recommended for the public. Surgical masks and N95 respirators are in short supply and should be reserved for health care providers. Is traveling good or bad idea? It's recommended to stay where you are. But if it's mandatory to travel abroad, then check with a travel advisory the restrictions and conditions of the host country. You may also want to talk with your doctor if you have health conditions that make you more susceptible to respiratory infections and complications. Most countries are in lockdown and have closed their borders for foreign travel due to the pandemic. What can I do if I am or may be ill with COVID-19? If you develop symptoms and you've been exposed to the virus COVID-19, contact your doctor for medical advice. If you need to go to the doctor or hospital, call ahead so healthcare providers can take steps to ensure that others aren't exposed. Take the following precautions to avoid spreading the illness. First, stay home from work, school and public areas, except to get medical care. Second, avoid taking public transportation if possible. Third, wear a mask around other people. Fourth, isolate yourself as much as possible from others in your home. Fifth, use a separate bedroom and bathroom if possible. Sixth, avoid sharing dishes, glasses, bedding, and other household items. Stay home, stay safe. Be sure to subscribe to this channel to stay tuned with the latest updates.